So chronic hepatitis, liver disorders, definition, liver disorders in which hepatic inflammation and necrosis continue for at least 6 months. So to diagnose chronic hepatitis, the person should have had necrosis and inflammation of the liver for at least a period of 6 months. Classification by cause, we are going to divide it into 6 categories: chronic viral hepatitis, autoimmune hepatitis, drugs, alcoholic liver disease, NASH, non-alcoholic steatohepatitis, and metabolic causes. The the metabolic causes include Wilson disease and hemochromatosis, which is nothing but copper toxicity and iron toxicity. And then chronic viral hepatitis are hepatitis B, C, and D. Chronic persistent, okay, so this is divided again into 4 types: chronic persistent hepatitis, chronic lobular hepatitis, chronic active hepatitis, and piecemeal necrosis. Chronic persistent hepatitis is classified by grade as minimal or mild chronic hepatitis and by stage as absent or mild fibrosis. We're going to divide it into minimal or mild chronic hepatitis, that is grade, and then absent or mild fibrosis is the staging. Chronic lobular hepatitis is classified as mild to moderate grade and absent or minimal fibrosis stage. Chronic active hepatitis is classified as mild to severe grade and mild to severe fibrosis by staging. Piecemeal necrosis is the minimal histological requirement to establish the diagnosis of chronic active hepatitis. Okay, piecemeal necrosis is the chronic active hepatitis requirement. So, liver biopsy needle which is done is called the Mengele needle. Autoimmune hepatitis could be of 3 types: type 1, type 2, and type 3. Type 1 is leupoid, type 2 is LKM, type 3 is anti-soluble liver antigen. Drugs include isoniazid and alpha-methyl dopa. So, classification by the cause of chronic hepatitis is chronic viral hepatitis, autoimmune hepatitis, drugs, alcoholic liver disease, non-alcoholic liver disease, and metabolic. Moving on to the pathology. Okay, chronic viral hepatitis pathology. There is piecemeal necrosis, portal fibrosis, bridging necrosis, interface hepatitis, and ground glass appearance. So 5 things. The overall like gross thing is going to be ground glass appearance. 2 necrosis will be there: piecemeal necrosis and bridging necrosis. Piecemeal necrosis is the minimal histologic requirement. Interface hepatitis is there because it is a chronic hepatitis, and then portal fibrosis. Pathology: hepatitis C, macrovascular steatosis will be there. Hepatitis D le microvascular steatosis will be there. Hepatitis A le marked cholestasis will be there. Okay, if it is macrovascular steatosis, it is going to be hepatitis C. If it is micro, it is D. If it is marked cholestasis, it is E. Okay, so about chronic viral hepatitis, clinical and lab features suggest progression of acute hepatitis to chronic hepatitis. Okay, so there are 4 categories, okay, 4 important points. Persistence of HBeAg for more than 3 months or HBsAg for more than 6 months after acute hepatitis is indicative of chronic viral hepatitis. Failure of serum aminotransferase, bilirubin, and globulin levels to return to normal within 6 to 12 months after the acute illness. So, like after half year to 1 year after acute illness, we are going to expect the AST, ALT, bilirubin, globulin, and all to return back to normal, right? After half year to 1 year. But if it does not happen, it's progressing to chronic viral hepatitis. Presence of bridging or interface multilobular hepatic necrosis on liver biopsy during protracted severe acute viral illness is also suggesting the same. Lack of complete resolution of clinical symptoms of anorexia, weight loss, fatigue, and persistence of hepatomegaly are all also suggestive. So the first one is clinical, the clinical symptoms, okay, like anorexia, weight loss, fatigue, and all, and examination of the hepatomegaly, and then liver biopsy values and liver biopsy picture, and then serum liver function test, and then serum hepatitis markers, all these things. Okay, so we have classification of hepatitis which is based on 3 things. Okay, based on the cause, so depends upon the causative agent, based on the grade, and then based on the stage. Okay, so grading is based on examination of the liver biopsy. It includes features like degree of periportal necrosis, piecemeal necrosis, confluent necrosis, bridging necrosis, and degree of portal inflammation. Most popular used scores are histological activity index in the US and METAVIR score in the Europe. Stage is based on the degree of fibrosis as categorized on a numerical scale